I'm going to ask Patrick to stand up and first go through some range of motion just for the lower back. So he's standing with those feet just about a fist width apart, and he's going to reach forward towards his feet. So I'm looking to see how well he can bend forward. Once he bends forward, I'm looking, how does he hold his head? How does the spine go? What sort of things is he feeling in this position? So I will ask him, where do you feel any strain? Where do you feel any stress? Carefully come all the way on up. Any areas that you felt strain?
My calves.
His calves. Feels strain in his calves when he goes through that range of motion. Now we're going to bring your hands on either side of your pelvis, so kind of towards a little bit below the waistband of the pants. He's going to lift his chest up and bend backwards. And what I'm looking for in this extension is, again, the quality of the movement, and then come back to the center, as well as, is there any pinching, anything that you feel in that range of motion going out? Good. Now bring your hands by your side. Now we're going to lateral flexion. So gently bend, bringing your right hand as close towards your right knee as you can, keeping both feet on the ground, and then come back to the center, and the same thing over to the left, keeping both feet onto the ground, and then come back up. And I'm looking at the quality. How much of a lateral shift is he doing? How well is he able to arc and bend over? Most of the lateral flexion is happening in the thoracic spine, in that mid-back area, but again, looking to see what's happening lower. Bring your hands across your body here. Now you're going to start at your pelvis at your hip area. You're going to pull your right hip back and turn your body over to the right. So you're going to continue turning around as far back as you can go. Take your hip away and then come back to the center and do the same thing to the left. So I'm looking, when he goes, I'm looking all the way down at his feet, all the way up the whole body, and to see how his body moves in this rotation. Come back to the center. So the point of that rotation is I'm looking to see, is there any part that there is any strain? If the lower back is feeling stress and strain in that area, that's an area of very limited rotation. So now I'm looking for compensations. So that's why I was checking what's happening at the feet all the way on up to see, is there some part that's not participating, or some part that's participating too much that's creating a shear force that's happening towards the lumbar spine. So I look at that range of motion from just the quality, as well as the range, as well as the other elements that are part of it, to be able to see and assess that range of motion.